There's another COVID surge happening here in the Bay Area and across the country. Flu season is also knocking on the door. So we want to find out if it is safe to get a COVID shot and a flu shot at the same time. What are some of the interactions that the two vaccines could do? So we're talking now with Dr. John Swartzberg from UC Berkeley. He is joining us now to give us some insight. Good evening.
Good evening.
All right. So if you have your full doses of the COVID-19 vaccine, what do you think about someone getting the flu shot, and how much space do you have to give between the COVID vaccine being fully dosed and getting the flu shot?
Okay, well, two things. Number one, it's really important to get the flu shot. If you're fully vaccinated for COVID, it's really important that you get the flu shot. The reason for that is that we have no idea what influenza is going to be like this year. Last year was a very light season, but on an average season, influenza kills anywhere from 10,000, 15,000 to 35,000 Americans. So it's a serious disease, not as serious as COVID, but a serious disease. So if you're fully vaccinated against COVID and you're vaccinated against influenza, you're likely going to escape getting sick, even mildly ill, from either one of these infections. The other reason it's so important to get vaccinated against influenza is that clinically, influenza looks just like COVID. You know, fever, body aches, cough, sore throat, looks just the same. As a doctor, I couldn't differentiate the two. I'd have to do a test. If you're immunized against influenza, that's going to protect you against getting sick. If you do get influenza, the doctor can put you on medication that will treat the influenza. We have pretty good drugs against influenza. The other point that I wanted to make in terms of your question is that there's no interval necessary between getting the second or even the first jab for COVID and getting the flu shot. That is, you could get them both on the same day. Frankly, I would probably get the COVID. If you've never been vaccinated against COVID, get the first injection against COVID. Then I'd probably wait a few days to a week in case you get a reaction to the COVID vaccine, you don't feel well for a couple of days, and then get the flu shot, and then get your second COVID shot whenever that's due. But if necessary, or if it's just more convenient, go down to the pharmacy or wherever you're going to get your vaccination and get the flu shot and the COVID shot, one in each arm.
So you see no issues with any complications with either shot making the other vaccine less effective, or there being any side effects from taking both?
Well, that's been studied in terms of efficacy of both vaccines if they're given together, and it appears to be just fine. So that's not a worry. People do get a reaction to the flu shot. They can feel punk for a little while. People certainly can get a reaction to the COVID vaccine. They can feel punk for a little while. So the two together might be additive. So that's why maybe separating them would give you a little space between those two. Although some people may say, it's much more convenient for me to get it now, and I just want to get it all over with in one fell swoop.
So now there's this Moderna and, correct me of how to pronounce it, Novavax hybrid COVID-19 vaccine?
Right, Novavax.
Novavax, okay, so they're trying to make, it's just one shot that's going to protect you against COVID and the flu? Right.
You know, we have lots of shots that are combined. We have diphtheria, pertussis, and tetanus, mumps, measles, and rubella. It's very common to combine different immunizations in one shot. It makes it convenient, and it's also much more comfortable for the patient. So wouldn't it be much more convenient to go in and get one jab and get the flu and COVID at the same time? That would be really cool. It's not going to be available for a good while, though.
Yeah, that sounds like something that's in the near future, or that they're working on at least. Can we talk about kids and vaccines?
Sure.
What do you have any insight on when kids under 12 could get vaccinated against COVID?
Well, I think before the end of this month, the FDA is going to get all the data from the drug companies, or from Pfizer first, and then probably a couple of weeks later from Moderna. It typically is going to take the FDA 6 weeks, 8 weeks to go over that data incredibly carefully before they're going to give it an emergency use authorization. So if that schedule is correct, I would anticipate that we could see kids between the ages of 5 and 11 getting vaccinated somewhere maybe around Thanksgiving or maybe early December. That'll be the first jab. But remember, if it's going to be Pfizer, it's then 3 weeks later for the second jab. And then it's 2 weeks after that before you reach full immunity.
So even with the younger kid vaccine, it would still be a 2-dose shot of Pfizer or Moderna. And is Johnson & Johnson also part of this under 12 group trying to find a vaccine?
Yeah, well, we don't have any data on Johnson & Johnson yet. So that's not going to be part of this first tranche of vaccines available for kids 5 to 11. Moderna, as I said, is probably going to be a couple weeks later than Pfizer. So the first thing we'll hear about and the first thing our kids will be able to get will be the Pfizer vaccine.
Pfizer vaccine, earliest late December.
No, earliest late November.
Late November.
Or sometime in December, probably early December. Fingers crossed.
I know, seriously. It will make school feel so much better for so many parents. Just big picture now of where we are. Is Delta still like what we should be the most concerned about, or have we sort of turned now into the Mu strain? Is that the next variant that is the most concerning?
Well, Delta is far and away what we have to be concerned about. If anybody who gets COVID now it's almost assuredly due to Delta. It's about maybe 1%, maybe 2% of all the isolates are something besides Delta. So essentially, America is Delta right now. There are variants that are out there that are of concern. Mu has received a lot of attention lately because the World Health Organization made it a variant of interest. Mu caused maybe up to 40% of the cases in Colombia earlier this year. It seems to be declining there now. It's been seen in multiple other countries, in Central America, a little bit in South America, and around the world. But interestingly, Mu's been here a while too, but it hasn't been able to compete with Delta. Delta is so transmissible that it appears to be not only outcompeting Mu, but it appears to be outcompeting everything else. It's the real gorilla in the room.
Are you in the boat that you think just at some point everyone's just going to get COVID and it's just a matter of how severely ill you get?
Absolutely not. There's no way I want to get COVID. You know, we can prevent getting COVID if we're vaccinated and just follow some basic principles, what we call the non-pharmaceutical interventions. You know, wear a mask where it's appropriate. Try to stay distanced from people you don't know. Try to avoid congregate settings. You know, you do those non-pharmaceutical interventions, and if you're fully vaccinated, the chances of you getting infected is really small. If you do get infected, the chances of you getting even mildly ill is small, a breakthrough infection. The chances of being hospitalized and dying are really small. You know, here in California, well over 95% of all hospitalizations for COVID are in people who are not vaccinated. Those are the people that are winding up in the hospital. Tragically, those are the people who are dying.
Is there anything else you want to talk about, especially now that President Biden put it this new mandate to get all these employees vaccinated? Do you think that's going to tip us over the edge, really get us closer to herd immunity? Is that going to make a difference if that many more people get vaccinated? Do you think people are going to listen to that?
Well, it's going to make an enormous difference if we get more people vaccinated. And we really wanted to get more people vaccinated, a lot more people vaccinated by them rolling up their sleeves voluntarily and getting vaccinated. That protects them and that protects their family and their community. Unfortunately, in spite of not only asking, cajoling, in spite of paying people to get vaccinated, giving them donuts, it just hasn't worked. There are too many people in the United States that aren't vaccinated, and that means that there are too many homes for this virus to go to, and that means that this pandemic just gets perpetuated, and it makes the world dangerous for everybody. So I think President Biden is absolutely spot on with his recommendations to get more people vaccinated. I know a lot of people don't like the idea of being told, if you want to work for the federal government, if you want to work as a contractor to the federal government, if you want to work for any organization with more than 100 employees, if you are a healthcare worker, all of you folks have to get vaccinated now. There'll be some exceptions in some of those circumstances that I said, where you could get tested once a week, and that would obviate that. But for most of the circumstances, it's going to be either work here, vaccinated, or work somewhere else. Yeah. And frankly, I'm sorry that it's come to that, but we have a world that we want to live in, and we want to go back to as close to what we had as normal as we possibly can. We're not going to get there for a long, long time, and many, many lives lost if people won't roll up their sleeve and get vaccinated.
Yep, I can't understand it. Thank you so much, Dr. John Swartzberg from UC Berkeley. We appreciate your time.
You're welcome. Thank you.